Section 1. Deciphering Death. The ICD's role in categorizing diseases. The International Classification of Diseases, or ICD, is a complex taxonomy of diseases. Like a universal medical language, it allows doctors globally to record and track diseases. Each disease is assigned a unique code, forming a vast database of human suffering. This system is crucial for understanding disease patterns, allocating resources, and guiding public health policies. However, within this intricate system lies a fundamental limitation. The ICD primarily focuses on the immediate cause of death. It captures the final blow, the organ failure, the infectious agent. Yet it often overlooks the years, even decades, of contributing factors leading to that point. This omission creates a critical blind spot in our understanding of health and disease. Imagine a patient succumbing to a heart attack. The ICD would accurately record this as the cause of death. But what about the years of unhealthy diet, lack of exercise, and chronic stress that silently paved the way? These crucial details, while acknowledged in individual medical records, remain largely invisible in the broader ICD framework. This omission has far-reaching consequences. It shapes our perception of disease causation, influences research priorities, and ultimately impacts how we approach health interventions. To effectively combat disease, we need a system that acknowledges the full spectrum of factors contributing to illness. Section 2. The Unseen Factors, Lifestyle, and Environment in the Shadow of Disease. Consider the case of lung cancer. The ICD would accurately attribute death to the uncontrolled growth of cells in the lungs. But this classification only tells part of the story. It fails to capture the decades of exposure to cigarette smoke, the primary risk factor for this deadly disease. Similarly, with type 2 diabetes, the ICD notes the body's inability to regulate blood sugar. However, it often overlooks the role of lifestyle choices, such as poor diet and sedentary habits, which significantly contribute to this condition. The environment we live in also plays a crucial role in shaping our health. Exposure to pollutants, access to clean water and sanitation, and even social determinants like poverty and education can significantly impact our susceptibility to disease. Yet these factors are not systematically captured within the ICD framework. This omission is not an oversight. The ICD was designed primarily for mortality tracking, focusing on the immediate cause of death. However, this narrow focus creates a distorted picture of disease causation, leading to an incomplete understanding of how diseases develop and persist. Section 3. A Myopic Lens. How ICD's approach impacts our health perspective. The ICD's focus on immediate causes can lead to a reactive rather than a preventative approach to healthcare. If we only focus on the final event, we miss opportunities to intervene earlier, addressing the root causes that contribute to illness. Imagine a house fire. The fire department arrives and extinguishes the flames, effectively addressing the immediate problem. However, if the underlying electrical fault that sparked the fire remains unaddressed, the risk of another fire remains high. Similarly, treating the symptoms of a disease without addressing the underlying lifestyle and environmental factors is akin to extinguishing the fire while ignoring the faulty wiring. We might achieve short-term relief, but we leave the door open for the disease to re-emerge or for other related health issues to arise. This narrow focus can also skew research priorities. With limited resources, funding often flows towards understanding and treating the immediate causes of death as categorized by the ICD. While crucial, this approach can overshadow research into the complex interplay of lifestyle, environment, and genetics that contribute to disease development. Section 4. Beyond the diagnosis. Can we reconcile ICD with broader causation? The limitations of the ICD do not diminish its importance. It remains a vital tool for tracking mortality, guiding public health policies, and facilitating global health collaborations. However, acknowledging its limitations is crucial to developing a more holistic understanding of health and disease. One potential solution is to integrate data on contributing risk factors into the ICD system. This could involve expanding the current codes to include information on lifestyle choices, environmental exposures, and social determinants of health. Such a comprehensive approach would provide a more nuanced picture of disease causation, enabling researchers and policymakers to develop more effective prevention and treatment strategies. Another approach is to develop complementary systems that specifically capture and analyze these risk factors. This could involve creating databases dedicated to lifestyle choices, environmental exposures, and social determinants, allowing for a more integrated analysis of their impact on health outcomes. Integrating such data would require significant investment and collaboration between various stakeholders, including healthcare providers, researchers, policymakers, and technology experts. However, the potential benefits in terms of disease prevention, improved health outcomes, and reduced healthcare costs make this a worthwhile endeavor. Section 5. Towards a holistic picture, reimagining disease classification for the future. Reimagining disease classification requires a paradigm shift. We must move beyond viewing diseases solely as isolated events and embrace a more holistic perspective that acknowledges the interconnectedness of our biology, our environment, and our choices. This shift requires us to embrace complexity. Human health is not determined by a single gene, a single exposure, or a single lifestyle choice. It is the result of a complex interplay of factors, many of which we are only beginning to understand. Embracing this complexity requires interdisciplinary collaboration. We need geneticists working alongside sociologists, environmental scientists collaborating with epidemiologists, and data scientists partnering with healthcare providers. Only by breaking down the silos between disciplines can we hope to unravel the intricate web of factors that influence our health. This shift also necessitates a change in our approach to data collection and analysis. We need to move beyond simply recording the presence or absence of disease and delve deeper into understanding the individual and contextual factors that contribute to its development. This will require investing in new technologies and methodologies for collecting, integrating, and analyzing complex data sets. Section 6. A new paradigm of prevention empowering individuals and communities. Ultimately, the goal of a more comprehensive disease classification system is to empower individuals and communities to take control of their health. By understanding the complex interplay of factors that influence our well-being, we can make more informed choices about our lifestyles, advocate for healthier environments, and work towards creating a society that prioritizes prevention. This requires a shift from a paternalistic model of healthcare, where information is primarily held by medical professionals, to a more participatory model, where individuals are active participants in their health journey. This shift also necessitates addressing health disparities. Social determinants of health, such as poverty, access to education, and racial discrimination, play a significant role in shaping health outcomes. We must acknowledge and address these systemic inequities to create a truly equitable and just healthcare system. The journey towards a more comprehensive understanding of disease is ongoing. It requires continuous questioning, evolving methodologies, and a willingness to embrace complexity. By acknowledging the limitations of our current systems and striving for a more holistic perspective, we can pave the way for a future where disease prevention and health promotion are central to our approach to healthcare.